The opioid epidemic gripping our nation has deep roots. Opium has long been used for its pain-relieving effects. During the Civil War, opioid use surged. Morphine became a battlefield staple. Its prolonged use led to widespread addiction. The Harrison Act of 1914 aimed to regulate opioids. It inadvertently pushed users towards the illicit market. For much of the 20th century, opioids were used mainly for severe acute pain. This began to change in the 1970s. Influenced by advocacy groups and new research, doctors pushed for better chronic pain management. Pharmaceutical companies marketed opioids aggressively, leading to a surge in prescriptions. This well-intentioned effort soon spiraled into a public health crisis. The surge in opioid prescriptions throughout the 1990s and early 2000s was fueled in part by misleading medical publications. These studies, often funded by pharmaceutical companies, downplayed the addictive potential of opioids, particularly new formulations like OxyContin. Doctors, relying on this flawed research and facing pressure to address their patients' pain, began prescribing opioids more liberally. This widespread prescribing practice, coupled with aggressive marketing campaigns by pharmaceutical companies, created a perfect storm for the opioid epidemic to take hold. Patients, often unaware of the addictive nature of these medications, found themselves dependent on opioids to manage their pain, leading to a sharp rise in addiction, overdose, and death. The human cost of this medical misinformation was staggering, leaving countless families shattered and communities devastated. The opioid epidemic didn't erupt overnight. Instead, it unfolded in 3 distinct waves, each more devastating than the last. The first wave, beginning in the 1990s, was characterized by a surge in prescription opioid misuse. As doctors wrote more prescriptions for potent painkillers like OxyContin, Vicodin, and Percocet, access to these drugs became alarmingly easy. People from all walks of life, athletes nursing injuries, workers managing chronic pain, and even teenagers experimenting with prescription drugs found themselves ensnared in the throes of addiction. What began as legitimate medical use often transitioned into misuse as tolerance increased and dependence grew. Individuals began taking higher doses or crushing and snorting pills to amplify the euphoric effects. This widespread misuse led to a dramatic rise in opioid-related overdoses and deaths, marking the beginning of a public health crisis that continues to plague the nation. Section 5, Wave 2. Heroin fills the void. As awareness of the prescription opioid crisis grew, measures were implemented to curb overprescribing. Prescription monitoring programs were established, and doctors became more cautious about prescribing opioids. While the efforts were necessary, they inadvertently paved the way for the second wave of the epidemic, heroin. Heroin, a cheaper and often more readily available opioid, filled the void left by restricted access to prescription painkillers. Individuals already struggling with opioid addiction turned to heroin as a readily available substitute. This transition proved deadly. Heroin, often laced with other substances, carried a higher risk of overdose and death. The potency of street heroin could vary drastically. making it difficult for users to gauge a safe dose. This second wave of the epidemic led to a further surge in overdose deaths, highlighting the complex and interconnected nature of substance use disorder. Just as the nation grappled with the devastating consequences of heroin, a third, even more potent wave of the opioid epidemic emerged: fentanyl. Fentanyl, a synthetic opioid up to 100 times stronger than morphine, infiltrated the drug supply, often laced into heroin or pressed into counterfeit pills made to resemble prescription opioids. The introduction of fentanyl into the illicit drug market marked a terrifying turning point. Its extreme potency made even small doses potentially lethal, significantly increasing the risk of overdose. The widespread availability of fentanyl, coupled with its low cost of production, made it a profitable additive for drug dealers, further fueling the crisis. This third wave of the opioid epidemic continues to claim lives at an alarming rate, highlighting the urgent need for comprehensive and compassionate solutions. Fentanyl is not a new drug. It has been used medically for decades, primarily for pain management in hospital settings. However, its illicit production and distribution have transformed it into a weapon of mass destruction in the hands of the black market. The current fentanyl crisis is distinct from previous waves of the opioid epidemic in its sheer scale and deadliness. The drug's potency and accessibility have led to a dramatic increase in overdose deaths, affecting individuals across all demographics and socio-economic backgrounds. The crisis has infiltrated communities across the country, leaving no corner untouched by its devastating effects. Addressing the opioid epidemic requires a multifaceted approach. While prevention and treatment are crucial, harm reduction strategies are essential to mitigating the immediate risk associated with opioid use. Harm reduction focuses on minimizing the negative consequences of drug use without necessarily requiring abstinence. This approach recognizes that addiction is a complex disease and that individuals may use drugs for a variety of reasons. By providing sterile needles, fentanyl test strips, and access to naloxone, harm reduction strategies aim to keep people alive and reduce the spread of infectious diseases. This approach is not about condoning drug use. It's about meeting people where they are and offering them a pathway to safety and ultimately recovery. Naloxone, often recognized by the brand name Narcan, is a life-saving medication that can rapidly reverse an opioid overdose. It works by blocking the effects of opioids on the brain, restoring normal breathing, and preventing death. Expanding access to naloxone is crucial in combating the opioid epidemic. Every first responder, healthcare provider, and community member should have access to this life-saving medication. By equipping ourselves with the tools to reverse overdoses, we can prevent tragedies and offer individuals a second chance at life. The opioid epidemic is a complex issue with no easy solutions. However, by understanding its history, recognizing the evolving nature of the crisis, and embracing harm reduction strategies, including widespread naloxone distribution, we can begin to turn the tide and save lives.